me talk about a very, very common condition and very fatal disease, especially amongst our children, that we refer to as meningitis. Even before I proceed, so that you will be able to understand what I tentatively mean by meningitis, we say that meningitis is the infection or the inflammation of the meninges and the cerebrospinal fluid. The word meningitis comes from meninges. The meninges are the three layers that protects the brain. We have the very inner layer that we refer to as the pia mater. We have the midrow, the arachnoid, and we have the outer part that we refer to as the dura mater. Before you penetrate all the way from the skin, you get to the brain, we have several layers. The inner part that is in contact with the brain is referred to as the pia mater. We have the arachnoid, we have the dura mater, we have cranium, we have periosteum, and then we get to the skin. Now, if there is any infection affecting any of these meninges, either the pia mater, arachnoid, or the dura mater, that's what we refer to as meningitis. This meningitis can have several causes. It can either be bacterial, it can be fungal, it can be parasitic, and it can also be viral. And in this case, meningitis, or most of the meningitis cases, the causative agents are either the virus or the bacteria. Now, meningitis can happen through many ways. It can happen through droplets of the saliva. It can happen through kissing. It can happen through even sputum. If you get into contact with saliva or sputum of a person who suffers from meningitis, then you are likely to get it. It can be spread through kissing. It can be spread through cough. It can be spread even through sneezing. So what happens is that when you get into contact with this bacteria or the virus, either fungi or the parasitic that carries the meningitis thing, it gets through the body through either the throat or the nostrils. It gets into the bloodstream. Then if it makes its way to the meninges, that's how it ends up causing meningitis. Meningitis is very, very fatal, both in adults and in children. But today I want to concentrate with it on the area of children because that is the number that is highly affected by it. So, the moment your child suffers from meningitis, there are common symptoms that these babies present with. Number one, they present with the hotness of the body or fevers. Number two, they present with inability to feed or poor feeding. They present with vomiting, drowsiness, and irritability. What we mean by irritability is this where when the child is not cooperating or the child is keeping on crying most of the time, the child, most of these kids, they will also present with persistent crying and neck stiffness. In most cases, this neck stiffness sets in after these other symptoms have presented, like the hotness of the body, vomiting, irritability, drowsiness, or inability or poor feeding. So when you notice your child is having all these symptoms with the temperatures of above 38, number two, this child is very drowsy, or in other words, it's very sleepy. This child looks very weak. The child is irritable, and there is vomiting associated with all without persistent crying, then we should always be cautious about meningitis. We say that meningitis kills within 24 hours if the treatment has not been initiated. When your child suffers from meningitis, of course we have several side effects that can result if this meningitis thing has not been addressed. Number one, children who suffer meningitis, or maybe they get treated in the later stages of meningitis, they are most likely to suffer some long-term complications. Number one, they suffer from hearing loss, or they turn up to be deaf. They suffer from loss of sight, or in other words, they become blind. They suffer a very serious condition that causes mental impairment causes limb impairment that we refer to as cerebral palsy. Cerebral palsy is just like your child now becomes lame. Your child cannot concentrate because this all will affect the brain and will also affect the motor and also even sometimes the sensory part of your child. People with meningitis, they can complicate and suffer from long-term epilepsy, or what we refer to as convulsions or the seizures. So majority of children who suffer from meningitis and they are treated late, or the treatment maybe didn't work very fast within the very first days, they are most likely to suffer all these complications. Number one about meningitis is that when treatment has been introduced very quickly or fast, most of these kids recover. All right? And let me say that meningitis cannot be treated at home, because majority of people, when a child maybe presents some fevers and where they go to the hospital, they get medications and they go back, and that's how this meningitis thing becomes very severe in children. I want you to understand that meningitis cannot be treated at home. This one is an hospitalization thing, or in other words that your child needs to be admitted. The treatment for meningitis cannot be given for less than 7 days. Most of the time, the minimum duration of time that we can give your child antibiotics for meningitis is a period of 7 days. We can even go to 10 days, we can go to 14, and we can even go up to 21 days, depending on how this child presents. How we get to diagnose meningitis, number one, how your child is presenting. If maybe your child present with all the symptoms that I mentioned there earlier, the hotness of the body, inability to feed or poor feeding, they present with vomiting, and they present with irritability, with neck stiffness, then we will always look on meningitis being the first impression. The second thing on how we diagnose this meningitis is by something that we refer to as the lumbar puncture. We puncture at the backbone of your child. We take the cerebrospinal fluid, we take it into the lab, and then we wait for the results. And another way that we can confirm your child has meningitis, even though it's not a clear way of confirming this, is via cranial ultrasound. In most cases, we take a cranial ultrasound or another test that we refer to as a crack test. Okay, so that is how easily we can diagnose meningitis. I will just want to give this one as a warning. Anytime you experience hotness of the body or the spiking fevers, the hotness that comes and goes, hotness of the body that comes and goes, your child is vomiting, and your child is not even interested in feeding, or your child has very poor feeding, then you should be very, very worried about meningitis, and you should take your child direct into the hospital. Let us all forget about this idea of anytime your child has fevers, maybe they have tonsillitis or they have malaria. It's not every fever that signifies your child suffers from malaria or suffers from tonsillitis. If you notice fevers that have been there for a duration of time, associated with poor feeding, and your child is keeping on every now and then they keep on crying, then be very, very worried and take that child to the hospital or to your pediatrician if you have one. So if this video is helpful to you, I request for your like, comment, share, and subscription. Until we do another video, I sign out.